Today, we are talking all about pregnancy. I know it's fertility TV, but we're talking about pregnancy today.
I'm fine.
Hi, everyone. This is Marc Sklar, the fertility expert, and welcome back to Fertility TV. Today, we're actually talking about gestational diabetes, and I have an amazing guest. Lily Nichols is here, who has been with us in the past, talking about this exact same topic. But today, we're going to go and talk about it in a slightly different way. So welcome, Lily. Thanks so much for joining. I appreciate your time again.
Yeah, thanks for having me, Marc.
Yeah, so I can't assume that everyone has watched our previous interview. So let's tell everybody a little bit about you and how you got into gestational diabetes.
Sure. I actually got into gestational diabetes back in sort of Researchville. I worked for the state of California for a program that where we helped train healthcare practitioners on diagnosing and treating gestational diabetes, and sort of wrote the public policy for the state, and then later worked in clinical practice with women with gestational diabetes. And it was there that I was kind of able to get out of research land and, into a practitioner's seat and see what works in clinical practice and put into play, the conventional guidelines, nutrition guidelines for gestational diabetes. And with gestational diabetes, it's elevated blood sugar in pregnancy, and food is the number one thing that you do to help manage it before you go to medication or insulin or anything like that. And it was really interesting to be in that role, kind of going at it from a reverse angle, because I realized that the conventional guidelines don't work very well. And, about 40% of women end up failing the diet for gestational diabetes. And I was like, but are they really failing the diet, or did the diet fail them? Because the conventional diet is pretty high in carbohydrates, and carbohydrates are the main nutrient that raises your blood sugar. So it would make sense that you should maybe consider going lower carb, but there was a lot of, pushback against that in the conventional community. So it took a lot of research on my end to understand what's safe and what's not safe in pregnancy. And I eventually developed my real food approach to managing gestational diabetes, which is nutrient dense and lower carbs. So not only are you not pushing the blood sugars high with excessive carbohydrates, but you're also providing a lot of nutrients that naturally help with blood sugar balance, and of course help for optimal development of their baby. So that eventually led to my book, Real Food for Gestational Diabetes, which we talked about in our previous interview.
Yeah, awesome book.
Yeah, thank you. And yeah, that's the approach I teach. That's what I do.
That's great. Yeah, really anytime here in the office that I need to refer to talk about gestational diabetes, and hopefully I'm catching them before they get there. But,
Right.
Your book is the book that I send everybody to. So I love it and refer to it quite often.
Thank you.
So if you're watching, two things: you can go ahead and watch our previous interview, because we go into a lot of detail on the book and on gestational diabetes. But also, if you might be one of those individuals who might be predisposed to it, then pick up the book and start learning about it now, so that you're ahead of the curve. So Lily, for those women watching, and maybe they're even watching with their husbands, which would be awesome. If they don't know much about gestational diabetes and they're trying to learn a little bit about it, see if they have it or anything like that, can you give a short intro or understanding of what gestational diabetes is?
Yeah, so gestational diabetes, there's a couple different ways to define it, but essentially it is high blood sugar that either first develops or is first diagnosed in pregnancy, which opens up a bit of a can of worms, because it's something that is caused by the change in hormones, which affect your body's insulin response, and weight gain during pregnancy. Or it could be that you had maybe mild pre-diabetes going on pre-pregnancy, or other things like PCOS. If you start your pregnancy at a higher weight, those can affect your insulin response. So it takes into account kind of a broad spectrum, but essentially if your blood sugar goes beyond a certain threshold, in pregnancy, then you get the diagnosis of gestational diabetes regardless of when it started or the exact cause.
Yeah. And I think it's also important for anyone out there who's watching who thinks that, well, I'm not overweight and I'm lean and, I'm healthy and I eat well and whatever, that they might say, oh, well, there's no way that I'm going to catch this. I see it all. I say catch it like, it's a cold. It's not, I should say I get it. I see this all the time as, a misstep on patients. Do you see that with the patient population that you work with as well?
Yes, absolutely. And in fact, when I was back working in public policy, one of the things that is hotly debated as the best way to diagnose gestational diabetes, and the screening protocol in the US. I know everybody hates the glucose tolerance test, the glucola, the sweet thing.
Yeah.
I mean, I kind of hate it too. I totally get it. But the way that we do the glucose tolerance test in the US, that most doctors do it, is different than the rest of the world and is less evidence-based. So if we actually follow what the rest of the world does, it's a single-step glucose tolerance test with an intermediate amount of glucose, and it's a fasting test. And there's different thresholds for what's high and what's not. We actually diagnose that probably about double the amount of women with gestational diabetes. We're catching more women who have like mild gestational diabetes, which I think is great because you can usually do so much more, nutrition for those people, but it does make the actual like diagnostic rate higher. And I don't think that's a bad thing, because what we're discovering now is gestational diabetes or high blood sugar in pregnancy, even below the diagnostic threshold of gestational diabetes, affects the baby's development. We're finding there's a research study came out of Stanford showing significantly higher rates of congenital heart defects in babies born to moms who had that just slightly elevated blood sugar. We're seeing, rates of macrosomia when the babies grow too large, not because they're super healthy, but because they're like just putting on too much fat, actually. We find that in women who have just mildly elevated blood sugars. It doesn't take a huge surge to have effects. So I think it's not necessarily a bad thing to diagnose more women if they're given the option for more proactive treatment. And we know that, women eating a lower glycemic diet, their chances of requiring insulin are cut by 50% if they're eating better, if they're not getting poor nutrition advice. So I think we could do a lot more preventative care if we catch it.
Yeah, we could do a lot more preventative care across the board, I think.
Oh yeah.
Blood sugar management is a huge epidemic that's happening across the world, and I'd say, for sure in the US. And it's leading to so many things. So we know that's an issue with gestational diabetes. Can you maybe give a short list of what might be the common causes for GD for everyone who's watching?
Yeah, meaning predisposing risk factors. So we mentioned PCOS earlier. So usually with PCOS, you have some level of insulin resistance going on. So if you come into pregnancy with insulin resistance already, and then pregnancy naturally screws up your insulin resistance toward the end for good reason, to try to shunt nutrients to the baby, but kind of works against us in our modern times. That's definitely a risk factor. Being overweight prior to becoming pregnant, again, that affects your insulin sensitivity. So that's a predisposing factor. Just being an older woman, and not like very old, literally like above 25, you're at a higher risk, because usually insulin sensitivity goes down as you get older. If there's any family history of diabetes, again, that's going to be a predisposing factor. And then if you're from an ethnicity where type 2 diabetes is common, like pretty much all the same risk factors for type 2 diabetes are the same as with gestational diabetes. So that alone puts you at risk, and that's completely out of your control, unfortunately. And then we're finding there's like some little niggly things that can affect it, like lifestyle things during your pregnancy. So eating a lot of higher glycemic carbohydrates sort of stresses out your pancreas more than it needs to. You just are forcing your body to produce more and more and more insulin. So you kind of burn out your pancreas a little bit
Mm-hmm.
pregnancy. So they've shown women who do a lot of like fruit juices and cereals and other things early in pregnancy tend to have a higher rate of gestational diabetes, gaining too much weight during pregnancy. Again, it's all about insulin sensitivity, and that affects it.
Awesome. That's an awesome kind of overview for everyone who's listening. And like I said earlier, if you want more detail, then Lily and I did a really good, extensive interview previously.
Right. And I should also say some women have no risk factors at all. So
right.
Like you were saying, there's like these people who are like, but why did I get it? I eat so healthy. I'm really thin. What's going on? There's like 50% or something of women don't have any traditional risk factors, and they still end up, you know, having high blood sugar and
falling into that.
So, you know, just, it's not always something you did to cause it. Everyone wants to like point the finger at themselves and like, I did this to myself, and not necessarily. Sometimes there's these things that are out of your control. So
yeah, that's good to recognize that.
Yeah.
So if someone who's watching thinks they might have it, they know they have gestational diabetes, or they want to be proactive about it, you know, the first thing, and we talked about this in the previous interview, we'll have a link to that in the notes on this one, is you know, just referencing your book that you showed us previously. But I know that, and one of the reasons I brought you on to again for an interview was to really go over your program. You created an online program that is based on your book, right? Can you let us know just kind of like a little overview about that?
Yeah. So the program shares the same name, Real Food for Gestational Diabetes.
Easy
enough. And it's an online course that walks you through pretty much everything you need to know. I had thought when I was writing the book that this was like, you know, super comprehensive and we're covering everything and it gives you everything you need. And then realized after getting so much more inquiry into one-on-one work with me that like, okay, people need a lot more support around this. Most women, you know, it's rare if you have a pregnant friend at the same time that you can, you know, share ideas with, but to find somebody who also has gestational diabetes and knows what it's like to have to check your blood sugar 4 times a day and carry around supplies and not be able to eat everything you want and give in to every single craving without worry. Like, it's nice to have somebody there to go through the program with you. So it's a fully online program. There are, you know, I give you all the information about checking your blood sugar. Instead of just reading through it, you have like me demonstrating on poking my own finger, you know, how to check, how to interpret the numbers. There's a lot of handouts that also go along with it that kind of walk you through things like, you know, a questionnaire to fill out before you're going to doctor's appointments to make sure that you actually get your questions answered, how to converse with your doctor, because, you know, if you're following my approach, it might be different than what their nutritionist recommends. So there's certain things that you need to be kind of upfront with your doctor about. I've expanded the meal plans. So in my book, I have, you know, a few days of meal plans, and in the online course, I have 21 days of meal plans that show 3 different levels of carbohydrates and walk you through how to, you know, customize figure out what's the right amount of carbohydrates for you and sort of customize your own meal plan. So there's just a lot more resources to go along with the information that you would get in the book. And of course there's, you know, food video lessons where you're actually seeing like, what is a normal size portion of carbohydrates, so you know kind of how much you can get away with. Have a little more carb tolerance, like what's an actual portion of fruit look like. Some of these things are visual things that are best done in person or in video. That's really hard to convey on paper.
Yeah.
There's a whole section on medication, exercise. I recorded exercise videos while I was pregnant, so you can see me doing, they're mostly Pilates based exercises, and I was a Pilates teacher, you know, previously. So it's really helpful just for not only for your blood sugar, but your own well-being to know, how to move your body and keep good posture so you feel good, have an easier labor, can recover from childbirth, and, re-find your pelvic floor muscles and your abdominal muscles after you've been through birth. There's a whole section on medication. Some of the research has updated since I wrote the book. So there's, additional information there. And then there's a bonus section. The most popular bonus I have is a full training on lowering fasting blood sugar naturally. So that's kind of the trickiest number. It's really easy to tweak your post-meal numbers by just reducing the amount of carbohydrates you eat for the most part. But fasting blood sugar is the tricky one. And a lot of women end up on medication specifically for their fasting blood sugar, which isn't a bad thing. However, sometimes there are things you can do nutritionally and with your lifestyle to bring your fasting blood sugar down. Sometimes, 10, 15, even 20 points in some women. So if you want the best chances to go about managing your blood sugar naturally and maybe not requiring medicine, that's a really helpful interview to go through, because, I've worked probably more than any other dietitian. I've really worked one-on-one with a lot of women to see what works and what doesn't. So I kind of walk you through like what to try first, what to try second, what to try third. It goes beyond just eating a snack before you go to bed. And then finally, there's also a support group, Facebook group that goes with it. And I have weekly office hours in there. So if you have questions, you've tried out some things for your fasting blood sugar, not sure what you should try next, like you can actually get my input on the spot and then, connect with other women in the group. So it's really great to just have that support network as well.
That's great. I mean, just that alone, that group, and with your, weekly office hours, that alone is worth it and valuable. So because the only way I have a baby myself, so I have very limited client time. And the course is less than a single hour consult with me cost-wise. So, and you can have ongoing weekly check-ins with me if you want, via office hours in the Facebook group. But you also get feedback from the other women, which I think is huge, because sometimes they have their own stories to share. Like one gal recently shared in our group about her glucose meter. Like the one that she had was not as accurate. And we had a whole discussion about like the most accurate glucometer. And it was even she brought up some points that, I hadn't seen before. When you work in clinical practice, oftentimes you recommend one meter. It turned out the meter that she found that worked best is the one that I had always used in practice. So like I hadn't run into women having ridiculously different blood sugar, but her blood sugar was like 20 points different on one meter versus the one that was more accurate. So that could be the difference between requiring medication or not, how ridiculous, so little things like that. It's really cool to have, this group to be in, and they learn from me, I learn from them. And it's an awesome, way to be connected. Yeah, I'm sure. No, I mean, that's super valuable, aside from all the different, modules that you have on different sections, and probably like myself with my programs, the ability to update those ongoingly as you need, which is nice. You can't quite do that with the book. So I know there's no one size fits all, and I know that everybody wants or needs different things. Why would someone pick and say, you know what, I'm going to read the book instead of doing your program, or I'm going to do the program instead of getting the book, and so forth?
Well, what's interesting is I've found that most of the people who join the program already have the book. And a lot of times they're either looking for more support, like the camaraderie of a group, or maybe my feedback on things. Definitely additional information on fasting blood sugar, and things like meal plans, more recipes, more ways to put what's in the book into action. So I think the real go-getters, maybe people who just have kind of like mildly elevated blood sugar, but they implement a couple things in the book, they see their blood sugar go down, easy peasy, then just use the book, you're fine. If you're kind of borderline with your blood sugars, you're worried you might need medication, or you simply want my feedback or to connect with course participants, I think that is definitely more helpful to be in the course. Plus you get lifetime access. So, you know, now we're in our like second year of running the course. So a lot of women have had their babies or maybe moving on to have their second baby. So there are, you know, I'm also a nursing mom. So if you have questions about breastfeeding, most of us in the group are also breastfeeding. So that's a really good place to get quick support on that. When you're nursing, you need feedback right away. You can't like wait a day or 2 days or 3 days to see a lactation consultant sometimes. So just getting that peer support is good. But also for women who are having their second baby, you're in the course for life. And we know that the recurrence of gestational diabetes in the next pregnancy is pretty high. That the estimates always change, you know, the statistics on it depending on the latest studies, but I've read anywhere from 40 to 70% recurrence rate. So if you know you're going to have, you know, blood sugar issues in the next pregnancy, and again, even if they're like below the diagnostic threshold but are kind of borderline, it's a really good thing to keep an eye on, especially early in pregnancy. So you have the course to return to, you have the support group on your hands, so it's like a one-time investment and it can be with you for your whole, you know, reproductive life.
Yeah, all your pregnancies. That's awesome.
Exactly.
Cool. Well, either way, if you decide to pick up the book or check out Lily's program, I do think that if you fit the bill and you fit into one of those categories and criterias that might cause you to be predisposed to gestational diabetes, I really highly recommend checking out one of those two resources for yourself and getting a jump start. And the sooner you do it, the better. It's only going to help you get it under control faster. So I do encourage you all to do that. Lily, thank you so much for joining me again today. I appreciate it. I'm sure everyone who's listening does. And like I said, we'll put a link to both the interview and the program for Lily as well. And you guys can check that out, in the notes in the comment section below and in the blog post as well. Thanks so much, Lily. Any last words you want to say?
For anyone who's wants to learn more either about the book or the course, I do have a free video series over at realfoodforgd.com. It's 3 videos and they walk you through sort of the basics of checking your blood sugar. So if you want to take the proactive approach and monitor your blood sugar early on, I give you the thresholds and a tracking sheet and everything, and then walk you through some common diet mistakes that women make with gestational diabetes. And I do talk more about the course within the video series as well. So that'll just help you kind of make the decision for yourself and see if it's right for you.
Cool. Thanks so much, everyone. Go on to the website, check out her video series, and find the resource that fits you best. Lily, thanks so much. I appreciate it, and I'm sure that everybody listening does as well.
Thank you, Mark.
Yeah, my pleasure. Until next time, everyone, we will see you on Fertility TV. All right. Bye-bye. Are you looking for more information on how to improve your fertility? Tips, useful information, how-tos, words of encouragement? Then you need to be part of my community. You can sign up for my newsletter right here.